sleep well tonight.
I feel absolutely exhausted.
Well, let's face it, we're not as young as we were. Do you want a coffee? Tony? 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 What's the matter? Are you all right? Oh, my God. Tony, speak to me. Help! Breathe, Tony, breathe.
Emergency services, which service do you require?
Ambulance, please.
An ambulance will be with you as soon as it can. You're going to need to put him on his back.
It's okay, I know. I've done CPR training. I've just never had to actually do it.
Okay, well, I'm going to stay on the line, so come back to me if you need to speak to me.
Okay, yes, thank you. Somebody help me, please. Somebody come help. Please, please breathe. Hello? Somebody there?
What's going on?
We just came back from a walk and I just found him like this. I phoned for an ambulance.
Is he breathing?
No.
We've got a defibrillator. Wait here. Look, keep going. You're doing really well. I'll do as quick as I can, okay?
And remove pad. Peel one pad from plastic liner. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Touch patient. Analyzing rhythm.
Okay, stand back.
Stand clear. Push flashing button to deliver shock. Start CPR.
If you ever find yourself in an emergency situation like this, where someone appears to be unconscious, check for danger. Then check response. Gently shake his shoulders and ask him loudly, "What's happened? Are you all right?" If he doesn't respond, shout for help. You need to open his airway and check for normal breathing. If he's not breathing normally, or you have any doubt, send someone to phone 999 or 112 for an ambulance. If you're on your own, you'll need to leave the casualty and do this yourself. Once you know that help's on its way, you need to start chest compression. Kneel by the side of the casualty. Place the heel of one hand in the centre of his chest. Then place the heel of your other hand on top of the first hand. Interlock the fingers of your hands and ensure that pressure is not applied over the casualty's ribs. You then need to position yourself vertically above the casualty's chest. With your arms straight, press down on the breastbone 4 to 5 centimetres. That's 1.5 to 2 inches. After each compression, release all the pressure on the chest, but without losing contact between your hands and the chest. Repeat at a rate of about 100 times a minute. That's a little less than 2 compressions a second. Compression and release should take an equal amount of time. After 30 compressions, you should give 2 rescue breaths. Open the airway again and pinch the soft part of his nose closed, using the index finger and the thumb of your hand on his forehead. Allow his mouth to open, but keep his chin lifted. Then take a normal breath and place your lips around his mouth, making sure that you have a good seal. Blow steadily into his mouth. Take about 1 second to make his chest rise as in normal breathing. This is an effective rescue breath. Maintaining the head tilt and chin lift, take your mouth away from the casualty and watch for his chest to fall as air comes out. Then take another normal breath and blow into the casualty's mouth again. You need to give a total of 2 effective rescue breaths. After the 2 rescue breaths, return your hands without delay to the correct position on the breastbone and give a further 30 chest compressions, then another 2 rescue breaths, and so on. This is called cardiopulmonary resuscitation, or CPR. Only stop if the casualty shows signs of life or you become exhausted. Don't expect the casualty to recover at this stage. You'll probably need to continue CPR until professional help arrives and takes over. A useful way to remember this procedure is to think of the ABC rules of resuscitation. Airway. The airway has to be open and clear so that the air can get to the lungs. Breathing. You need to check if the casualty is breathing normally. CPR. You need to perform chest compression combined with rescue breathing. A, B, C. If you're unable or unwilling to give rescue breaths, then just do chest compression. It's much better than doing nothing at all. Once help arrives, they may use an electrical device called a defibrillator. This is designed to give a controlled electrical shock to the heart. This may get it back into a rhythm that allows the heart to pump blood around the body.
G52 years of age, sudden collapse this afternoon into cardiac arrest. CPR found out by his wife on scene. Arrived at the GP, done 2 shots on the patient, and gave him back an output. Spontaneous respiration, GCS, and condition is as you see in live.
Previous history?
No previous history, no medication.